A lot of mothers want to know when they're going to start feeling those first movements, and for most this happens between about 17 and 20 weeks gestation. Mothers who have had babies before might start to feel movement a little bit earlier, like around 16 weeks, because they know what to look for. And some moms may not feel movement until around 21 weeks, especially if they have an anterior placenta. That's a placenta that's attached on the front of the uterus, and so it's basically acting like a shock absorber and preventing the mother from feeling a lot of movement. Really, this delay in movement until 17 to 20 weeks is just because of the size of the baby. They're not big enough for you to feel the movements, but that doesn't mean that they're not moving. If you watch your baby on ultrasound, you'll be able to see tons of movement. It just takes a little bit longer for them to be big enough to cause an impact so that you feel it. Movement will start to get more and more regular until between 26 and 28 weeks, you will start to feel regular movement. And the best indication that you have that your baby's doing well while inside of you is that they're moving. So it's something that you should pay attention to all the time. It should be a part of your routine. Wake up in the morning and think about your baby moving. Think about it all throughout the day and before you go to bed at night. And by the way, a baby can't move too much. That's not a bad thing. So you're looking for a decrease. If you see a decrease, then get rid of all distractions, because sometimes that's the reason that you're not feeling movement. You're just thinking about other things. Lay down on your side, because that's how your baby gets the best blood flow, and count every single movement. And if you get 10 or less than 2 hours after that 26 to 28 week mark, then you need to go to labor and delivery and get checked out. Now, the best indication that you have that your baby's doing well is movement, and the best way that we have to test your baby's well-being in the hospital is to watch the pattern of your baby's heart rate, and that will tell us how much oxygen they have. So, best case scenario is that you come into the hospital, we check your baby out, and we can send you home reassured that your baby's doing well. And peace of mind is priceless, so it's never, ever a waste of time to go to the hospital and get checked out if you're concerned about your baby. A lot of moms also have questions about the quality of movement. Like as the pregnancy progresses, instead of feeling big kicks and punches, the movements might feel smaller, and even small movements count. So again, just pay attention to them throughout the day. And if you're feeling less than usual, count and go get checked out. It's never a waste of time if you're concerned. If you have more questions for me in the future, please feel free to ask them on our Facebook page at facebook.com/Intermountain Moms, and recommend us to your friends and family too.